Thank you all for coming back. So you've seen my face a couple of times. So my name is Laura Takis. I'm the clinical director and therapist at Virginia Mason Separation and Loss, working with Dr. Reinierson. I'm not very savvy with these. I either shout or I back off, so please let me know. So I'm going to be your moderator for this morning's panel. So just to get a bit of a background, what we're going to be discussing, looking at this morning are prevention, intervention, reentry, and postvention in children and adolescents as it relates to suicide. Okay. So I'm going to introduce the panel members at the moment. We have Sue Eastgard, MSW, and I'm highlighting that because I too am an MSW, which is a master's in social work. Yeah. Sue is the interim director for training and programs at Forefront. Yeah. Then we have Jen McCormick, the clinical director, also MSW, at the Healing Center. Beverly Goldsmith, MSW, coordinator for Safe Crossings at Providence. And then finally Lucy Berliner, clinical director at HCSATS, Harborview Center for Sexual Assault and Trauma Center.
Another social worker.
Yes.
The former Harborview social worker, too. I feel very involved.
So thank you, everybody, for joining us. This is a very applicable topic, children in schools, suicide. I will let them talk. I won't give it away too much. But so each presenter is going to have about 20 minutes to present with 5 or 10 minutes question and answer period afterward. So if you could just hold your questions, and then you'll have time for after each presentation to be able to ask and get feedback. Thank you.
There, check it out. There they are. Thank you for this invitation and opportunity to speak. I want to say a bit about Forefront and invite you to take a look at what's out on the resource table. Forefront is a relatively new organization. We are based at the School of Social Work at the University of Washington. We are doing suicide prevention across the lifespan. We have partnered with as many people as we can possibly partner with in this effort to make sure that we are addressing the issue collaboratively. Forefront, in part, is doing work in schools, which I'm going to speak a bit about today, and also then doing work in particular, and what's out in front is on the tables is our program called Forefront Cares, and we are a program that is focused on providing support to newly bereaved families and individuals in the aftermath of a suicide. So one of the things that we do is we actually send the old-fashioned remember when you, in neighborhoods where you got a welcome wagon, kind of, someone came to your house when you're new to the neighborhood and brought you a bottle of wine or some kind of maybe even just cookies. My neighborhood, there was wine. So we're very much in the same kind of notion that we are interested in extending a hand and saying to the newly bereaved suicide survivor, welcome, not to a family that they wanted to join necessarily, but to a group that they need to know that there are others there who have suffered and who have lived through this tragedy. Kristen Spexharth is the coordinator for that program, and she actually fills the bags, fills the boxes, and sends them out to newly bereaved people. So if you know of individuals who have had a loss to suicide and who would appreciate a CARES package, we modeled the CARES package out on the table. It includes everything from resource books and information to bars of chocolate, because what do people need is comfort and Kleenex and information. The other thing that we do is invite people to mentor to newly bereaved individuals. So we are actually training people who have had a loss to suicide and pairing them with a similar loss. So mothers who have lost children to suicide talking to newly bereaved parents who have lost a child to suicide, partners, siblings, parents, whatever that lost relationship is. And not to be overlooked in this whole process, and I think often it is what it means when a good friend dies by suicide. So even if there's not a biological relationship, it's important that people have an experience of getting support. It probably needs not to be said in this room, but I say it anyway, and that is therapists are wonderful. I think therapists are great in terms of providing support, but if you don't know what it's like to celebrate Father's Day after your dad has died, then you need to be able to talk to someone about what that experience is like, because many therapists don't have that unique and individual experience, and everyone else is getting a card and celebrating and having a barbecue with dad, and your dad has died. So it is really powerful to have those connections. We do not see them as counseling. We see them as support, short-term telephone support at no cost, but the extension of this family to us is incredibly important. How am I doing this moving ahead? Are you moving? Left forward. I think I can do that. I want to say a bit about just the issue, because I come at this, besides forefront cares, in terms of a focus on prevention. We lose in the state of Washington about 2 kids every week to suicide. Let me just be very clear that those are 2 children and young adults whose death has been indicated as suicide on a death certificate. So without a doubt, we have more death as a result of suicide that simply are not quantified as such. When Forefront came into being, I am co-founder with a woman by the name of Jennifer Stuber, who's faculty at the School of Social Work, whose husband died by suicide. She is not a clinician. She's a community advocate and an expert in policy, particularly around mental health stigma and media. And she said to me, Sue, what can we do to prevent more loss of life? Nobody else should have to go through this. And one of those great conversations that you do at Starbucks at University Village here, and big business happens. And she said to me, what we should do is go to Olympia and see if we can pass a law that would require all behavioral health professionals to have training in suicide assessment, management, and treatment. And I, having only retired 6 weeks before I met her, at a really nice party, I want you to know that, and I said to her, Jen, that will never happen, just won't happen, but okay, I'll go along with you. And went to Olympia, and lo and behold, in 2012, the first state in this country to pass a law that now requires all behavioral health professionals, psychologists, social workers, mental health counselors, marriage and family therapists, and believe it or not, occupational therapists asked to be in the bill. So yay for them. So there is this mandate that requires behavioral health professionals to get training. That was amazing, and Jen danced around, and I woke up with anxiety attack because I couldn't figure out who was going to teach all these 29,000 people who are now required to have training, which is really how Forefront came into existence. The following year, we went back to the legislature. I was more enthusiastic this time, and there was a second law passed that now requires school personnel to have training in suicide recognition and referral, absolutely understanding that they are not doing, for the most part, the same kind of counseling and intervention that licensed professionals are doing. So this particular law does a number of things. Number one, it requires that in at least the public system in the state of Washington, what we call ESAs, or Educational Staff Associates, now have to have 3 hours of training in, again, recognition and referral. The second piece of this legislation required that every public school have a school plan that included prevention, intervention, re-entry, and postvention. So many schools have nothing. Some have postvention, this sort of focus on what happens in the aftermath of a student death. I'm particularly interested in the prevention pieces as well as re-entry. A young person goes off hospitalized at a local hospital. Parents phone in every day, say, I'm sorry, my daughter won't be at school, and yet never tells the school where that child is or why that child is away. Child returns, no communication many times with where that student has been or what that student needs. So we're trying to really do much more with public schools around the re-entry piece. And the small little piece that we got on this piece of legislation included tacking on some content for teachers in a class they're already required to receive before becoming certified in public education, a class called Issues of Abuse. And now suicide prevention is a part of that training. So this is a piece of legislation I will tell you, even though this panel is on children and adolescent, the following year and this past year we went back to Olympia. We seem to live there in the first 3 months of every year. And this past year we completed, and with many people's support, a bill that now requires all primary care physicians, naturopaths, occupational therapists got included again, physical therapists, you name it, they are included. And my colleague Jeff Sung, psychiatrist and a trainer, we're trying to do as much training to reach people who are impacted by this legislation. So Forefront is busy being involved in suicide prevention. My task today is to talk to you more about the school work. I also just want to say a bit about the specific work we are doing with a grant that's the Jolene McCaw Foundation here in King County provided us the resources to work with 14 schools, high schools in this community in King County. So they include public schools, private schools, and parochial schools, and really looking at how to do comprehensive suicide intervention, comprehensive suicide plan or approach in schools, and it includes these things: a school plan, teacher training, and I say peer-to-peer here because I want to be really clear with you. I don't go into a school and teach. There's no sustainability in that. We are teaching teachers to teach their peers. We are teaching parents to teach other parents, because when the grant goes away, the program shouldn't be over. And the relying on experts to come in and teach doesn't sustain anything, number one. And number two, it continues to perpetuate the notion that only experts can teach this information. And I believe you can teach a parent or a teacher how to deliver content. It's our content. So really important. And we are doing a number of things. And the final thing on here is that we really wanted schools to have a vetted list of resources that they could refer to in the community. And one of the things that we're asking schools to include on their community resource list are only the names of professionals who've been to 6 hours of suicide assessment and management training. Don't give me a therapist who doesn't know how to do this work. What we quickly realized is that beyond what Forefront was doing is that many schools after a death occurred were doing some postvention work and then forgetting about all of the necessary grief support that needed to happen. And so we involved several people on this panel in the process, Jen McCormick being one and Beverly being another, who were helpful in getting us to even move this needle farther. So and I don't really think that, anybody here working in a school? Didn't think so, but you're going to hear about it anyway. There is this marvelous resource, free, that I want you to know about. You can get it printed or you can download it from the internet, but SAMHSA has created a toolkit for high schools about how to do prevention, intervention, re-entry, and postvention. I have one copy. The first person to come up after the presentation may have it. It's a door prize. So I'm going to very quickly, because I have to watch my time, I want to talk about these 4 elements, and then I'm going to pass the baton or answer questions. Schools need to think proactively around ways to prevent suicide, but that really involves being prepared. So there's a whole list of kind of elements that schools need to look at before a crisis. Who gets trained? What gets trained? What kind of providers are there? And if there's a death, when there's a death, who gets notified and by when? Much more detail, but those are examples of things. We also need plans that include how to respond when a young person is identified to be at risk. First of all, how do they get identified? And if they're at imminent risk, high, moderate, or low, what happens, what documentation needs to be done, and what options are available to that young person and their families. There needs to be, as I've already said to you, some true identification about what do we do when a student goes off and comes back, and how do we support that student. So they've missed 3 midterm exams. What accommodations are made for that student, and in fact, who gets to know about where they were, and what does the teacher in particular get to know, and what's helpful and what's crossing a line. There are a great deal of pieces to know about postvention. I'm not going to spend any time except to say schools really need to look at what happens next day as well as longer term. I will end and just answer your questions. Before I came this morning, I had a very long conversation with an unnamed school. There was a death in spring. They did no postvention work. Students have come back, as well as the staff this year, and counselors are saying, I guess we need to do something because we didn't do it in the spring. So we can't do the same process, but we certainly need to do something to help support them, or I believe they'll probably have more suicides. There will be, they're not there yet, but they will be soon on the Forefront website, these protocols and procedures that if you are aware of schools, if you have children who attend schools, here's my takeaway and request of you. Even if you don't work in a school, but you are a parent or a grandparent of a child in a school, ask that school to see a copy of their crisis plan.